Great. Thank you for those inspiring remarks and putting us in a larger frame around the culture of health work and what we have in front of us to do. So next, I'm going to ask our first panel actually come up, and I'm going to briefly introduce each of them. So Raynard Kington, he was appointed president of Grinnell College in August 2010. And prior to coming to Grinnell, he served in a range of positions at the National Institutes of Health, including the NIH Principal, Deputy Director, and NIH Acting Director, and NIH Associate Director for Behavioral and Social Sciences Research. So thank you, Raynard. We have Will Valiant. He's a second-year PhD student in the Emerging Infectious Disease Program at the Uniformed Services University of the Health Sciences in the Preventive Medicine and Biometrics track. His research focuses on the antibody responses to the Zika virus infections in a non-human primate model. So is Will here? Yes, okay, great. And we have Second Lieutenant Ahmed Madha, is currently a second-year medical student at the Uniformed Services University. He earned his Bachelor of Science at the University of Pittsburgh, where he majored in neuroscience. And after graduating in 2014, he worked at the Safar Center for Resuscitation Research, studying traumatic brain injury before matriculating at the Uniformed Services University. And finally, we have Alexander Bilyeu. He's a director of the Division of Population Health, Incentives and Infrastructure in the Preventive and Population Health Group at the Center for Medicare and Medicaid Innovation, CMMI. He's an internal medicine physician focused on improving the health of vulnerable communities through access to comprehensive primary care and cross-sector public health policy. So I invite you to come up. Thank you.
Well, it's my great pleasure to be the moderator for this first session. Many of us who've participated in public health research had the experience over the last 40 years, 30 to 40 years, of watching this ramp up in the knowledge base about health inequity and health disparities. And what's been distinctive about the last 10 to 15 years is the movement away from just describing and understanding pathways toward intervening, bridging this gap between the knowledge base and actually doing something and then looking at the outcome. I have my own Martin Luther King quote. We'll see if he can keep this up all day. From his letter from Birmingham jail, which I highly recommend, is worth rereading, particularly at this point in our history. He said, "Human progress never rolls in on wheels of inevitability." That you can't, there's no assumption that because we have the knowledge that it's somehow going to happen. We have to make it happen. And we have two great examples today. I think each will take about 10 minutes, and then we'll open up for conversation at the end. So we're actually starting a little bit early, so this is a good sign. So why don't we start off with William Valiant and Ahmed Madha.